And for Minister Dix, can you break down a little bit more the logistics of getting the vaccines when the province receives it? How many days does it take to deliver to the health authorities? How long does it take for the health authorities to get it to the clinics? And how far in advance do health authorities know the supply of vaccine they'll be getting so that they can book in vaccination appointments accordingly?
So in general, we've had pretty good, pretty consistent delivery of Pfizer. The amounts that we expected to receive, we've received, and that has been the workhorse vaccine, as is illustrated by the numbers and the amount of Pfizer that we've vaccinated people with. Moderna, as I've just expressed, is substantially less consistent, the arrival of the Moderna vaccine. And again, we received over the Easter weekend, I think Easter Sunday or Easter Saturday, about 72,000 of the doses that we'd expected to receive the week of March 22nd. And so that presents some challenges because it's arriving, and we're not sure when it's arriving. The doses from Moderna that we were expecting to get from the federal government this week won't be arriving till at least next week. So that presents some challenges. So in general, we receive vaccine one week, and it's part of the delivery the following week. We tend to get Pfizer on Monday, and then it goes out. And we tend to get Moderna when it arrives on time on Friday. The bolus, the big, large amount of AstraZeneca we got last Friday, I believe, and that will be used and is being distributed to pharmacies around BC. It obviously goes, a significant amount of it goes directly to the site, so it will go, say, if it's to be used in Northern Health, to Northern Health, but a lot of it comes into a central hub. So basically, you get vaccine the one week, and it's part of the clinics the following week. So it's receive, distribute, put in people's arms, and then that week, of course, at the same time, you're putting in people's arms. So that's generally what happens, but especially with respect to the Pfizer, we've had to move very quickly, and sometimes it'll be available in a day or two because we've had weeks where we have about a third of a day's supply of Pfizer left, and we have to, as soon as it arrives, get it out to clinics where we booked appointments. So that's the planning part of it. The Moderna question has made it more difficult for us, but in general, we have, I would say, an overcapacity of an ability to deliver because we want to deliver right away. What you're going to see in the coming weeks is a slight lessening in the supply. So just, in the few days, just to put it in context, in the few days prior to some tweets from the federal government and some discussion from federal ministers about vaccine supply. So we received about, in the few days before Monday, April 5th, for example, we received 30% of our total amount of vaccine we've received since the beginning of the pandemic. In the few days before that, that's with Pfizer, AstraZeneca, and Moderna, about 423,830 doses, and we're moving quickly to deliver that to British Columbians and hoping that the next amount of supply comes the following Monday. So it's a pretty quick turnaround. It can be a couple of days, but if you're distributing, for example, to remote or rural communities, it obviously takes longer than that to deliver. But I think our folks are performing really efficiently in this process. We've got a lot of capacity out there, and I think the user-friendly registration system that's been put in place is going to help us in that as well.